Dr. Carmen Bonilla. She received her dental degree from forgive me if I butcher this, Dr. Bonilla. I practiced my Spanish very much just for this moment. Universidad of Benemerita Autónoma de Puebla in the
Yes,
state
that's
of
correct.
Puebla, Mexico in the year 2000. She was in practice of general dentistry for a number of years, and in 2005, Dr. Bonilla received her Endodontic Certificate from the Universidad Autónoma de Tlaxcala.
Right.
Dr. Bonilla is a diplomat of the Mexican Board of Endodontics, and she has been involved in academics since her graduation from UAT and practicing exclusively endodontics. Her major areas of scientific research interest include regenerative endodontics, dental trauma, cleaning and shaping, and root canal irrigation. Dr. Bonilla is an internationally recognized lecturer, and she's the author of several scientific papers in peer-reviewed journals. Dr. Bonilla is an active member of the American Association of Endodontists, as well as the Mexican Endodontic Association. Dr. Bonilla is an assistant professor at the Endodontic Department at Nova Southeastern University, College of Dental Medicine in Fort Lauderdale, Florida, and she also works in faculty practice here at Nova. AAWD is extremely privileged and honored to have Dr. Bonilla join us on our Doc Talk series. Everyone, please welcome Dr. Bonilla.
Wow, you guys are so nice. Thank you very much for having me. This is such an honor for me to share a little bit of me with you guys. Thank you.
We feel very thankful, Dr. Bonilla.
No.
All right, so we're going to just jump right into it. We're going to start with our first question. Now, tell us a little bit about your background, where you grew up, and could you elaborate a little bit more on your educational path, starting with your undergraduate studies?
Well, as you said, I'm originally from Mexico. So I was born and raised in Mexico. And I decided to be a dentist because it took me to that path. That is a long story. I will share that with you later. So I did my dental school and started in 1996, I guess. After I graduated, Mexico, they have a different systems. We don't go to college. We go straight from high school to university. So I started like a very young, when I was 18, the dental school. And then since day one, I started working the next day. My dad sent me to find a job, something related to dental. So I knocked a door in an office that it was nearby my house, and I started working as an assistant. Probably the second day that I started being a dental student. So I think that my dad did really good on that, pushing like I have to work hard to give the value where the things are, and then just be sure that I really want to be a dentist. And then after I finished my dental school, that it was a journey of 6 years because it's different. Latin America, they have a different systems here. Since we don't go to college, we have to do more. And then we did 5 years of dental, plus 1 year, 1 year of service to the community. So you work, it's like a GPR. You work in a community that you do pretty much everything, and you are the doctor in charge, and the government pays for. So I think that it was a good experience. It compensates a little bit what you guys do here when once you graduate from college, that you go to dental and plus you do a residency. Pretty much we have the same amount of time and years studying and practicing in patients. So that was how I ended up being a dentist, or how my background started it. And then I don't have any family member who's a dentist before, so we are the first generation, my brother and I. So I feel very grateful for that.
Nice. Did you mention it was your twin brother?
I have a twin brother who's a prosthodontist, so we worked together for a number of years. That was very, very nice because actually the day that he graduated a semester ahead of me because I was hesitating what to do. I was good in math, so I really want to become an engineer, but my dad was pushing a lot, like, why not you just choose a career for a woman that it fits better in your personality. And it's like, okay. So I was and my brother was like, why don't you just become a dentist and we're partners in the future and we put an office? And it's like, okay, why not? So that's why I was like exploring more like math and another engineer careers, but the I don't know, it's just the destiny took me to the other side, and that's why I became a dentist. And then I was working with my brother for 12 years together in a practice in Mexico. And it was fun because he used to refer me all his cases. And then we used to work together all the time until I decided to move to the States. And then I sold my part of my practice, and then now I'm here.
Thank you. Thank you. Thank you for that very detailed background. Those are stuff that we wouldn't have known. So thank you. So the next question is, why endodontics? And did you always, well, I think you kind of just explained it. If you always wanted to know that you wanted to be in that field, but you just said it. So I guess we could start with why endodontics?
Why endodontics? Honestly, I have to say the truth. When I was in dental, endo wasn't my favorite. It didn't catch my eye like, oh, wow, this is fun or this is nice. I felt like endo was okay. And actually, when I did my residency or the service year that we do, I spent like 1 year in a pediatric clinic. So I was doing a lot of kids, a lot of vital pulp therapies, a lot of ortho in kids, and I did a lot. And I was strongly convinced that I'm going to be a pedodontist. Then when I started working as a general dentist, so 80% of my consult was coming with the chief complaint that they had pain. Okay. And I was like a fresh new graduate who did not know about a good diagnosis, or probably I wasn't enough prepared how to do like root canals in a molar or complex cases. I was trained the same way, like we do some few cases. I just did my requirements to be able to graduate, but I didn't had the exposure to do enough to feel enough comfortable doing my own endos. And then this is 20 years ago, because I graduated in 2000. So 20 years ago, that was the beginning of the implant craziness and the boom. And then my brother and I, when we started working together, we saw this problem, like half of the patient was getting or needing endo, and the other ones, they want implants. So my brother, after 4 years or 5 years practicing together, so one day we closed the office, well, we finished and we were like just talking about life, and he said, Carmen, the money is running away from that door, because we are referring all the endos, and we are sending all the implants somewhere. So we have to flip a coin. Someone needs to do endo and the other one needs to do implants. We flip a coin. And this is a real story. We flipped the coin, and then I got endo, and he got implants. So he specialized to do implants, and I specialized to do endo. So that's how I ended up applying to an endo residency, and I started looking for programs and applying. And the one that I found is the one that it has an externalship with Nova. So that's how I ended up the connection. During my residency, I came to Nova as a resident to do an internship. So that's how I ended up like coming to Nova. But that's how I became an endodontist. But let me tell you one thing. Once I started the residency, and I was like, wow, I like it. I'm using a microscope, and then I have the sensors. By 20 years ago, having a sensor, it was like, wow, this is so nice. When I was a student, when I did the dental school, we used to take x-rays with a small plate, and then we used to have we have to go to a dark room and develop the x-rays in an old-fashioned. And it was horrible because imagine you taking a working length x-ray. So you put the plate, instead to go to the computer, you have to go to a dark room with 3 different liquids. You have to suck every plate in the liquid and develop the x-ray. And then if your bad log is like it's off angle or it's cut or it's bad, you have to go back and take another one. That was like very, very old fashioned. So when I started doing the residency with all this technology, microscope and sensors and all these new tools, we're like, wow, this is so cool. So endo is not as bad as I thought because I was trained with the very basic. That's why I feel so grateful that we are teaching at Nova the top of the quality and the top of the technology available right now in 2020 in around the world. So you guys are so lucky because you are not learning the old-fashioned way. You're learning what is the real deal right now.
Very grateful because I can't see myself running back and forth from a dark room.
I think that the worst part of that endo, that was the X-rays. The X-rays was bad. That was really bad.
Us going sometimes just around the clinic, going from just our chair to waiting in the computer line is a headache. So
imagine you like taking working length,
yeah.
master cons.
Well, that was 5 people crammed in one little dark room trying to develop. No.
So that's why when I started doing my residency, and it's like, wow, this is so nice, and we have microscopes, and we have ultrasonics, and it's not as bad as I thought. And then is when I fell in love with endo. I was like, wow, this is. And then since day one of my residency, I totally fell in love with the specialty, and I haven't regret myself yet to be an endodontist because it's been fun. It's been a long journey, a long process because I've been changing my techniques a lot because I'm in the middle of the generation that I was like at the old-fashioned hand file. Then the rotary came to the market, so I was trained with the rotary after the microscope, and it's like I've been part of this transition and technology. But it's nice. It's nice because I've been enough lucky to be part of this transition.
Perfect. So speaking of endodontic procedures, most people, when they hear the word endodontics, they think root canals, but this isn't all an endodontist does. Could you elaborate a little bit more on the procedures that may be included in this field?
Yeah, I think that you're totally right. This is one of the things that the people just think like root canals, and then we're just filling canals and that's it. But actually, our field is so diverse and big on so many things that we can do. So the first is that probably people doesn't know, like in our specialty program, we have rotations in pediatric dentistry. So we see a lot of kids because sadly, sometimes the kids with a very high risk of caries, they can have a root canal in a very early stage. And they're like, sometimes they're not the easiest patients, or they're more difficult to work with because it's really bad that a 6 years old or 8 years old is going to need a root canal under anesthesia, and then we have to go through those procedures. But surprisingly, the kids are very nice patients, so it's nice to work with them because as long as you say the truth and they trust you, you can work with them with no problem. So pediatric endodontics is a field that it's not as the same as the regular endo because we have more challenge. We have open apexes, we have behavior management, and the challenge of the occlusion because not all the teeth are in place. So it's like it's a little more complex, a little more challenge, more things to think like a regular straight endo for a number 8 or number 12 that it's already with a closed apex and it's in occlusion. It's not. This is a different thing. Then we also work in relation with ortho and endo, because sometimes we need the other specialties to work combining together when we do ortho extrusions in a cases that we want to save the tooth, and we can do the regular endo, but we need the orthodontics to help us to do an ortho extrusions. But sometimes we can do our ortho extrusions, and then we can do a surgical extractions and replace the tooth in the place that we want to do it. And we can do our own extrusions, not by orthodontics, but we can do our own extrusions and just put in a splint and then do it ourselves. Then another procedure right now that is being like lately, then the literatures, they've been reporting more and more cases, and the endodontic world, it's like keeping more attention to that, is try to do what we call the viral pulp therapy. Is when the patients are in a very early stage of irreversible pulpitis or deep caries that we are excavating, and the symptoms are not like clear from irreversible pulpitis, and then you feel like you have an exposure. Sometimes we try to do like direct pulp caps with new materials like MPA or biodentin or any bioceramic, and we are going to try to avoid the root canal. So instead to doing more root canals, we're going to try to avoid and educate the people that it's fine to not have a root canal as long as we put the right material in the top of the pulp, because sometimes if it is an early stage, the pulp has the capacity to regenerate and then just become normal again. So that's another thing that we do. And another thing that is very cool for us, it's the apical surgery. So that's when the is no other options that we try the retreatments, that the case fail, or the first root canal went wrong and we retreated and it's a persistent infection, because sometimes the biofilm that it's growing outside of the root of the tooth, it becomes so stronger that we don't have the ability to clean inside of the tooth and make that the case be successful. So another thing, that alternative that we have, it's doing apical surgery. So the apical surgery, it's a field that most of the people know that we do, but we do microsurgery. Since we are working under the microscope, this is the big advantage for us, and I feel like we are in the advantage that the other specialty don't have, because we see way more things than the rest of the specialty because the magnification. So doing a microsurgery, we have the ability to see and remove the portion of the apex that is infected. And we have these micro mini mirrors that we can see, and then do retrofields. And then with ultrasonic, we can go and then remove all these bad obturations. So the apical surgery is also a field like it's really interesting for us, because it's a very meticulous job that it takes us to a smaller field than what endo is, because endo is already a small field. Okay, we always work in millimeters, but the apical surgery is like a way too smaller, and then we're more detailed. So I think that endo gives us so many things to do, because even if we are doing a root canal, as you have done a root canal, not all the teeth are the same. So every tooth is going to give us a different challenge. So I have done root canals for 14 years, and I don't remember that all of them are the same. No, my principles, my concepts are the same, but the challenge of the anatomy, where the tooth is positioned, how the patient is, it's like so many factors that they're combined. They make that your case is going to be unique every single day of your life. You will never have exactly the same case, and this is it's fascinating, because you're not going to get bored to this. It's like you just keep the new challenge. It's always something new.
Thank you, Dr. Bonilla. I think my most favorite part about that was the apical surgeries. That was something very interesting that I learned about while I was in your class, and then shadowing also in the PG clinic. So thank you so much for elaborating a lot on that and teaching us about the broader picture of what endodontics is.
if they get a chance and they walk past the endo section in PG, it's amazing to see when the PG residents will put it on the screen and you walk past, and I mean, it's just the microsurgery it's amazing. And if you're lucky, you may get to catch an apical surgery, and it's kind of like, it's funny because you'll see a bunch of people standing in the hall and they're watching the TV, not the procedure itself. It's cool. It's very cool.
Yeah, I think that having the microscope connected to the monitors, it gives this is made for the assistants, that they can have a better view which step we are, so they can be prepared for the next step and they can handle the instruments in the right way. This is number one. And the second reason why we have those screens is because it's this more didactic purpose, that the rest of the students who they are shadowing or the ones that are assisting, they can have a better view what we're doing. Because sometimes I feel like I like to work in silence all the time, because it's like I have to be very concentrated when I'm working on. I'm not at the type of person who's talking all the time while I'm working, but so sometimes if you are just in silence working, your assistants can get lost because they don't even know what you're doing right now. So, but if they have the screen, or they have a second, we also have a second optic for the assistants, so they can take a look and follow what are the steps that you are doing during the procedure. So that's one of the reasons. But yeah, but if any one of you guys want to stop by any day in endo, and especially this is the season that we are doing a lot of surgical procedures, because our second year residents are about to graduate and they have to complete at least 40 apical surgeries per person. This is one of the programs that is the strongest in the nation, that they train the residents with the most number of surgical procedures in the United States. So for me, it's like, so actually, I have a meeting at 7 p.m. with my residents, and another faculty, because on Friday, next Friday, we have two surgeries scheduled with the residents. So we always review the case, we review the CBCT, we discuss the cases before we jump into the surgery. So anyone is invited to come and watch. And then if you want to assist, it's a really good experience for you guys, especially if you are interested in endo. Okay, so be my guest. Anytime that you want to stop by, you can come.
All right, pretty cool. Thank you for sharing, Dr. Bonilla. I'm excited. I still haven't watched one of those surgeries, so I'll have to make my way up there.
Friday, December the 4th, we have scheduled one in the morning, one in the afternoon.
All right. So I have a more fun question for you. So what is something that you like to do outside of work, and how do you balance with work?
Well, as you know me, I think that now I have a reputation at school, because everyone probably know me that I'm a crazy runner. And then for me, running is been one of my passions. And I don't feel like I do the running to release my stress. I feel like the opposite. Running, it gives me so much happiness and joy that I can be happy at home and at work. So for me, the running has been a compliment. I've been an active kid since I have memory, because I didn't say that, but my parents put me in a military school for 18 years. So I did my kindergarten, high school, elementary school, everything in a military school. So they were like, the sports were a thing in my life. So since I was a kid, I was doing a lot of exercise, and then I played tennis, and I did a little bit of everything. But the running has been part of my life for forever. I stopped running when I was in dental school. I have to confess that I dedicate my life to study and party. But after dental, when I start practicing, I feel the need that is like, I have to do something for myself right now. Otherwise, I'm not gonna last, because being a dentist is a profession that requires a lot of posture habits, bad or good. If you started in an early age with a good habits, you may last longer than the bad habits, okay? So I started running. A friend of mine invited me to for a 5K for the cancer awareness, whatever it was, like 20 years ago. And I said, okay, fine, 5K. Okay. I started training for my 5K, and I went to the race, and they gave me a t-shirt, and then they gave me a medal, and it was all crowded, and the people was like, you were running, you cross the finish line, and you get a beer, and you chit chat, and you made friends, and none of them, they were dentists, none of them, they were talking about dentistry. Like, wow, this is so cool. And I started doing that for a few years. Then someone invited me to a 10K. It's like, okay, fine, a 10K, and start running 10Ks for another number of years. Then a half marathon, because the 10K that wasn't enough. And then I started doing half marathons, and I have like, I don't know, 60 or 80 half marathons in my life. And then when I turned 40, 5 years ago, I said, like, I need a new goal in my life. So I need to set something new and another challenge for me. So one night I was like looking at the New York Marathon, and the ballot was open. So I put my name on. It's like, I'm just gonna see if I can get a spot in New York to celebrate my 40th birthday. I would run a New York Marathon. And I got lucky. I got into New York the first time that I applied to the lottery. And then I started training for a marathon. And then since 2015 that I ran my first full marathon, now I've been running full distance. Every year I run like 2-3 marathons. And then I've been running a couple of marathons. I have run Chicago twice, New York 3 times, and then some marathons around the world. But yeah, it's like now running is my passion, combining with Pilates. But I think that the running for me is taking it to the level that it gives me so much joy and happiness that I know that if I'm running in the morning, my day is gonna be complete no matter what. So I'm gonna go to school in a nice mood, and I know that it's like I'm gonna have enough energy. And the day that I'm not running is like, oh my God, I'm so tired. I can do anything. And it's like I feel like I need my push from the running. It gives me a lot of energy. That's how I started running, and I don't think that I don't want to stop. I see myself like, gosh, I see all these old people running slow. I want to be like that. I want to be like the old lady running, like kind of walking, running, but I want to last. So I hope that I can do it.
No, I'm sure you will. That's so impressive, Dr. Bonilla. I haven't gotten past the 5K, so you will have to train us all.
I'm gonna say one thing that the running has been for all these years. What I learned from the running is no matter what the distance you are doing, it's the discipline. One of the reasons that I started running and I tried to do the marathon thing is because I used to be more. I've been organized all my life, but not like a super organized on my schedule, on my discipline as a person. But I felt like something was missing for me. And then I said, like, I have to change something in my life that it needs to make me a better person. And for me, they need to have discipline on my life. It's a proof for me, no matter how many miles I run in the day, just to wake up at 5:15, put my shoes and push myself to go out, for me, that's the challenge, because I'm fighting with my demons every single morning. And it doesn't matter if you're walking or you're running or you're doing bicycle, you're doing something. It's like, and then I get a lot of this from the students. Oh, how can you do this? How can you wake up so early? How can you do? Why? It's like, do you feel like I'm waking up happy? No. Do you feel like I want to do this? No, I don't want to. But it's the only way that I can prove myself that I can have discipline. Then discipline is going to bring you a lot of positive things in your life. If you don't have discipline for something, let's suppose that you guys don't want to run. And it's like, no, Dr. Bonilla is too crazy. Running is not my thing. Because a lot of people say like, yeah, running is not my thing. Okay, don't run. But wake up every day and dedicate to yourself 45 minutes. To what? I don't know. Maybe read a book, enjoy your coffee, take a long shower, have a nice makeup, something that dedicates the time to you, to make you feel happy. Okay, when I can't run because it's raining or it's too hot or something, I do yoga or I do something. But believe me, for me, the battle that I have every single day that I have been through 10 years or 20 years that I've been running is the same question every day. Like, what about if I cancel myself and I just continue sleeping? But the sleeping is not going to give me the energy that gives me the exercise. So it's not about the exercise, it's more about the routine and my discipline. If I break up my routine, then I feel bad with me. Well, and the medals and the traveling and the running and my friends, like that's something that I really like it because I'm married with a dentist who's an endodontist. So my closest friends, all of them are dentists, as you know, that Dr. Maharis and Dr. Ospina, they're my best friends. So it's like impossible for us to not to talk about dentistry, even if we don't want to. So for me, it's like a mental health. Don't have more friends that they're dentists. Like when I'm running, I'm just talking about life, clothes, weather, politics, whatever I can't talk inside of the school. And it gives me more sanity on my brain.
That's some awesome motivational advice, Dr. Bonilla. Definitely need to instill some more discipline in my life.
One life, I will be more than happy. And then last year, I started pushing my residents like, I'm gonna run Miami Marathon. Anyone wants to run a marathon with me? And they start like, how hard is run to a marathon? Like, well, like, you know what? If you haven't run a marathon, what about just do half? And they start like pocketing it. And then I got like a half of my residents running a half marathon for the first time with me in Miami Marathon, and it was amazing. So they were so excited. And then a few from a pre-doc ran as well, because we have a few runners in pre-doc that they have done marathons, so they ran as well with us. But we ended up being a nice group from Nova running the Miami Marathon. So it's like, for me, it's always nice. Like if I can change one life, I will be done. It's like I'm happy with.
Great. No, you've inspired me. I'll let you know if I wake up tomorrow at 5.
You don't have to make a big changes in your life. It just started little by little. I started running like a short distance, and now my next challenge is doing like ultra marathon that it's more than 50 miles. And I signed up for a 200 miles running that it's going to take me 4 days to cross Florida. So that's another crazy thing and level. But it's just me. Dr. Bonilla, as a person, I have to see challenge in my life because that's the way that I color my life. That's the way that I feel like my life, I'm painting, and I wanna put some colors on that paint. But if I don't set a goal, like for example, okay, I know that I have to give seminars. I need to read, I need to study, I need to do this, I need to do that. But I've always set in a goal, like I love and I have passion for my garden, and I love to take care of my plants, and I love orchids, and I have a very nice garden in my house. But if I don't set a goal, like okay, this time I'm gonna try to grow tomatoes, or some challenge, like a small thing, like I'm gonna keep alive my basil, so I have to put some water every single day, and I don't have to forget about my basil. Kind of those things that I have to challenge myself to make things better. But don't look for crazy things. Try to make small little challenges on your life, and you will see, like a little by little, you're gonna try to get another one and another one and another one. So
Great,
just find a good spot.
great advice. I love it. So our next question is, what do you wish you knew when you were applying to your residency programs? And going through that process, now that you can look back, what advice or what do you wish somebody would have told you?
Well, I think that for endo, I wish that someone told me that at the beginning I'm gonna struggle, because my specialty is dealing with pain all the time. And then I had these conversations with this conversation with my residents a few weeks ago with the first years, because at the beginning, when you are in residency or when you are applying to the residency, everyone says like, well, you do endo and you're gonna make a lot of money, and this is one like a specialty that you see the patient once, at most twice, and then you are done, and it's like you don't marry with the patient like a pros or ortho, like you have to see the patients like for 4 or 5 years, or like a long treatments. So endo is like technically you see the patient once or twice at the most, and you are done. Okay. And then you get your money right after. It's not like you're waiting and waiting. It's different. So that's the beauty of our specialty. But no one told me like the sad part is like you have to deal with patients in pain all the time, like meaning 100% of your time. So when I apply it, it's like everyone like, oh, this is all pink and this is all nice. When I start doing the residency, it's like I perform. My patient is in pain and he's calling me, I have pain. And you just started root canal, I'm in pain. I'm still in pain. It's like all these type of things. Or when you get those patients that they're like in a really bad pain that you can even know how to handle because you are not prepared. So at the beginning is you have to struggle and you have to live that frustrations, and it takes a while to understand how the pain it shows in every single patient, and you start like start reading type of the personality that the patients that you have. And now by now 14 years later I can predict who's gonna make the tantrum, who's gonna be in pain, who's not, you know. But one of the things that I learned, actually that was from Dr. Seltzer, since I've been teaching for 10 years here. And then even if I was an endodontist before, I was carrying the pain in a different way with a different vision. But something that I learned from Dr. Seltzer, that I'm so grateful to work with him, because I've been learning a lot from him, especially for diagnosis, because he's really good on diagnosis. And I will never stop learning from him because he's an open book. But one day he said, Carmen, you have to grow a thicker skin and you just have to let it go. And it was like, wow, I didn't think about it. And it's true. So it's little by little that it's some different ways that you have to handle the pain, and then you have to make make your patients feel comfortable, but you don't need to carry those worries to your house or to your personal life, because it's very difficult to disconnect from the beginning. Like when you are done and you're exhausted, to come home, it's like, oh my God, is my patient still in pain? Oh, I did wrong. Oh my God, I perf. Oh, I separate an instrument. And it's like you're suffering. It's like, hey, relax. It's a tooth. It's not the end of the world. We are not perfect. So for me to accept that sometimes we have to make mistakes to learn, that was hard, very hard. And I cried like a baby. And then my first perforation, I cried. The first time that I separated an instrument, I cried. And I was like, oh my God, no one told me that this wasn't perfect all the time. But now it's like, okay, if I perf or if I separate an instrument, thanks God I haven't doing that for a while. But if it happens, it's like, okay, we're human beings. We're not perfect. We are trying to do as much as we can to provide the best care to our patients. And this is not with an intention. So it's something that I've been learning little by little, like how to control those emotions through the patients. I don't know if you guys have that experience in clinic, but sometimes you have patients that they have a lot of anxiety, and you don't even know how to talk to them because you get anxious too. So it's like a process that no one told you before to be a dentist, and no one told me when I applied to residency how hard it's going to be at the beginning to handle this. Now it's gone, that anxiety, but I still have sometimes like, okay, like I just saw a patient this afternoon, and as soon as I got home, she's texting me, I'm still in pain, I'm still in pain. Okay, relax, give you some time, take your medicaments, let's see how it goes, call me again. It's like the way that you talk to the patients, or how you spread the confidence, and then they're going to feel more comfortable. And then it's like a cycle. Whatever you express or whatever you release, that's what the patient is going to get. And it's a cycle. But now it's gone. I'm not struggling the way that I used to struggle before.
No, great advice. We've experienced in clinic. So our next question is Tika. She can share also.
Yeah, so just branching off of that last question, in your opinion, what makes a strong applicant for an endodontic residency? And what are some tips you have for some future applicants?
Well, I've been part of the committee for a few years, and it's like the Endo department, they random select the faculties. So sometimes I am part of the committee, some years I'm off, and we just have to like switch and random. So every faculty had the opportunity to participate when we are choosing the residents. Overall, the department always is gonna look first in your CV, okay, what you guys have done. If you have a basic CV versus someone that is being like doing a GPR or doing a internship, something related with endo, or they have been assisting an endodontic practice during the weekends, or they're being like part of or working as with a research project with a resident, or they have been, I don't know, presenting on ASDA or idea, or one of those things like meetings or publications, or those type of things that they're improving your CV, is always going to look way better than someone who had a basic CV. That's number one. Okay. Number two, of course, the GPA. It's important. It's like we are looking forward to see great minds, bright minds. And so we always want to have like the best of the best. Sometimes, and I have to confess, the grades, they don't reflect the clinical skills. Sadly, the interviews are too short, so we don't have the opportunity to see how they are in the clinical settings. But for me, in endo, I feel like we should have like an interview like in the clinic to see how the people behave. But and then we are looking also for the type of personality. as I was talking about how we handle the pain and how stressful is our specialty, sadly, dentistry is in the rank that we have the most stressful, one of the top of 5 most stressful professions in the nation or around the world. Dentistry is not an easy field because it's already very stressful. And then from the specialties, endo is one of the top ones that the people, it's more stressful. So we are always looking that type of personality that we want residents that we personally, I'm always looking for a happy person, because if I see that someone has a very like a shy personality, personality counts a lot in this specialty. All the specialties, because at the end of the day you have to sell your treatments, because what we want to do, or what you guys have to do by the end when you're choosing a specialty or you're going to be a general dentist, is that you want to sell your product. How good you are going to make in life in terms of money is how good you are selling your product, how good you can sell your own treatments. Okay, but if you're that type of person, like you are like very shy and insecure, endo, you're going to struggle. You better do something that it doesn't need like a lot of interaction with patients. So that's why for me, I think that one of the biggest things that I'm looking for a resident is like I have that type of personality that it can be feeling good in our field because of the level of stress that we manage. Okay, I think that will be the 4 things that I will advise, like improve your CV. When you are doing an interview, try to show yourself as a secure and happy person, because that gives you a lot. It's something that we always like to see. Just be confident. Okay.
Yeah, that's kind of tough this time around with COVID, doing virtual interviews, because you can't show your personality as much as you want to. Like you can try, but it's pretty difficult to kind of convey it. So I don't know how that kind of.
Yes and no. You can read a lot of things when you are doing an interview, since the way you're dressing, you are talking, you're moving, your hands, your eyes. Let me tell you one thing. I'm the youngest faculty, but the other faculty, they have way more experience than me, and I can tell that probably they see the same things that I can see. When I have someone who's in an interview, I don't know, it's like you want to give the best of you during an interview. But sometimes you have applicants, they didn't even care. They come late, or they just like, whatever, and they just answer whatever. It's sometimes they're not prepared, and then you can see ones that are very well prepared for the interviews. And another advice is like, try to practice your interview with some of the faculty. That just make some questions and like do a Zoom meeting with one of your faculties. And if you have a good team leader, just ask them, like, just practice your interviews and see the way that you talk, the way that you move, and how do you present your CVs, all those type of things to improve your chances. Now, endo, this year, I don't know, it's because of the COVID and the people realize that, I don't want to sound like bad with the other specialties, but it wasn't an emergency to place an implant or a crown during the pandemic. But the endo specialty was the only specialty that we didn't shut down, that we were allowed to see patients because we were open. We have been open from day one since the pandemic started. So money wise, people is realizing that endo now is a very good specialty. And then because of that, this year, we used to have in the past like a 60 applicants, 55. This year, it was 2 different things that doubled the size of the applicants. One is the COVID, and the most important is that the chairman that we have right now. Our new chairman is a very well recognized doctor in endodontics, that he is very well known around the world and everywhere. So I think that makes our program more likable, I guess, or people wants to come and be trained by him. So we got way more applicants this year. We have like I think that we crossed like more than 100 something. It was very tough.
Yeah.
And then for us, it's really sad, the selection, because having people from Nova, and then sometimes you have so many applicants from outside that they are so good that it's a very difficult decision for us to pick and choose the applicants. It's believe me, every time last year I wasn't in the committee and it's like, oh, thank you, Jesus. I don't want to be there because I'm suffering with my students, because a lot of people is interested in endo. So we have every year we have more and more D4 applying or D3s applying to the endo program. So it's good for us.
Yeah, it's good. It means something, about your program and about you guys as faculty too. Everybody loves. I remember, I'm not a fan of doing endo, but I loved the class because, you're a great instructor and you made it really easy and less intimidating to like learn something. So that's probably it. Just my next question is, what's your most favorite and least favorite part about being an endodontist?
The most favorite is because I have the power to change my patient's lives in terms like I can save a tooth, I can resolve the pain problems, that's something that is, I think that I will never get tired of that. Like just feeling that I can help people with that, relieving pain. It's very, very, very grateful for me. It's like you have no idea how good you feel when it's like, wow, I was able to relieve the pain and I was able to help someone in a way that they're gonna keep a tooth and they're gonna save the tooth. I think that is one of the ones. My least favorite is like, I would love to wear high heels and a dress like Dr. Katami every day and look pretty in the clinic. And it's like, I'm always stuck with my scrubs and my sneakers. And then it's like my specialty is always like full of bleach and emergencies, like running around, like going back and forth. And I'm always in the craziness, like taking a CBCT, doing this and doing that. It's like we never end. And it's like we always are the last persons to leave the clinic. We always are stuck with emergencies. It's like it's a 24/7 thing. It's sometimes it's like, gosh, I need a break. But because I see the other specialties that they're like more chill out and they have a different pace. But endo it's always like that. So you have to have the energy to maintain that, not only in the school, in private practice. Because when I talk to my residents who graduate, it's like, Dr. Bonilla, this is not even close what we were living in residency, because they have 20 patients scheduled in a day and they started at 7 and there's have consults, patients, and it's crazy. So it's intense, very intense, but well, that's what I choose. I mean, so I have no time to regret.
I gotta say though, with your scrubs and sneakers, you always have the best ones and you always look tip. So don't worry about
Thank you. But I try to do my best to don't feel as bad, because sometimes when I see these pretty doctors walking in a high heels, in a dress, or in a nice business casual style, it's like, wow, sure I can do that. No.
Megan,
my best friend is the bleach, so I can't.
Dr. Bonilla, I know you're a little pressed for time, but we just have a couple more questions if it's okay.
Sure.
Okay, so currently women make up about 19% of endodontists. With your experience of being a part of that 19%, do you feel things are changing for the better now? or how do you think we will be able to change this statistic?
Well, I think that Dr. Maharis and I, well, it's funny because in academia, the vast majority were women, because academia gives us a lot of time for family and combined family and work with less stress than the private practice. But for the other hand, I think that Dr. Maharis and I, we are making a big effort pushing in our department that we have to give the same opportunity to our residency. So last year we were pushing a lot to let us get 3 women and 3 men for the residency, because I think that if we started changing just a little bit, just to be equal numbers, it's gonna reflect better in our programs. Because in the past they used to have all men, and then even if we have a lot of women as an applicant, they used to take more men than women. And I feel that it's something that we have to change little by little. And then now we have 50-50, and it's something that we want to keep pushing, that we can have more women in our field. Definitely it's a field that gets very stressful and it's high intense, but I feel like as a woman, since we have this we're gifted because we can be a multitask persons. So I think that women, they can handle a family, be a parent, be a soccer mom, and be an endodontist at the same time. You guys are too young, and then probably it's not the time for you like to think ahead, like what I'm gonna do if I'm gonna be an endodontist and I'm gonna have a family. But or not even a family or kids, that you can combine your specialty with so many things at the same time. But I don't know. It's like it's because the level of stress is, or because we are in charge of another things when you have a family. But I think that it's been changing little by little. And then now, last year, our past president of the AAE was a woman. So that was something that was a major change in our specialty. And then more and more people, more women are involved in academia and now at the AAE. So it's been changing little by little, but and I don't know why, because I feel like at dentistry, it's kind of 50-50. We have more women than men, but by the end, when we apply to residency, they don't choose endo as a first choice. Or the same as oral surgery. I think that oral surgery is more men than women, and endo is the same. But if you compare to ortho, probably they have more women than men. It's just the challenge or the complexity of the specialty. But I think that we're gifted to be women, because we can do a lot of things at the same time, and then endo will be a piece of cake for us. But I don't know. It's changing a little bit.
Good.
I hope that next year they can pick 3 and 3.
Let's hope so. But I just wanted to let you know we are so grateful that you've decided to have this chat with us. And if there's anything else you'd like to share, who are tuning into this interview.
Well, no, thank you for the invitation. I really enjoyed the time to talk to you guys and share a little bit of me, because it's like, as I said, we always are busy at school and sometimes we don't have time to talk about personal life or things. As much as I love to spend time with the students, sometimes I can share my story, or they see my post on the social media, my running, my crazy running every day. But no, thank you for the invitation. And then you guys know that I'm always open and I'm super flexible with my students. So if any one of you guys want to reach me out for any questions about endo or about the running or anything, I'm more than open, and then we can have another chat about running if you want.